Hello, viewers, and for those of you watching me right now, this is Dr. Isatu Kakay-Diallo. I know I was live on the 8th of September telling you about my recent COVID-19 status, even though I was fully vaccinated, but I was positive for COVID-19 on the 7th of September with symptoms. I know I promised that I'll come back and update you on really what's going on with me, and that's what I'm really trying to do today. I want to first start by saying Alhamdulillah Rabbil Alameen, Tando Bialanya, meaning praise be to the Almighty Allah for, getting me up again today to be able to talk to you. I want to say many thanks to all those who prayed for me, family, friends, co-workers, different acquaintances. I want to say thank you. I appreciate everybody for the prayer, keeping me in your prayers. And I want to say today I'm much better, and my symptoms did improve as the day progressed with the COVID-19 result. The day I spoke with you guys, it was a mild symptoms, but as time went by, the following day, I find that I had about, up to 60-70% improvement in the symptoms that I was feeling, which was nasal congestion, runny nose, the headaches, and the pain around my ribs. All those things did improve, and in about 24 to 48 hours. The only thing that I tend to still have, it's lingering, meaning it's still there. It's mild headache, which is also part of the symptoms. But as you can see, I had mentioned my eye. Today, you would not see that swelling. You would not see that redness that was there. So definitely doing better. And I'm off the quarantine, the 10 days quarantine that I was mandated to do by the state, because that's a recommendation. When you are sick, you stay home so you don't get other people sick, you don't get other people exposed. So I really want to say thank you for all those that are watching this now, or the ones that would watch it later. I want to say that COVID-19 is still real. If you haven't got your vaccine, try to get your vaccine, and also try to adhere to all the different measures when it comes to COVID-19, the mask wearing, hand washing, social distancing. And if you qualify for the booster dose, make sure that you get the booster dose, which I hope to get mine as soon as they recommend that for all other individuals. As we had discussed before, the booster dose were for immunocompromised individuals, people that are taking active chemotherapy, people that have cancer, people who have HIV on treatments, people that are taking high dose corticosteroids. Those individuals are qualified, to get the COVID-19 booster dose. Well, again, if you haven't taken your vaccine, make sure you get your vaccine. Either one of those vaccines are effective in either reducing your symptoms if you get sick with COVID-19, or preventing you from getting sick from the deadly virus that we have going on in the world right now. Until that, I just want to say many thanks for listening, and I hope we all stay safe, and we look forward to this pandemic ending before the year ends, or in the upcoming year, because last year was much worse, and this year we've seen the cases are much improved, places starting going back to normal, some areas, schools are back to normal, and all these things are important to look at and see that it's an improvement in what we are doing, or what we have achieved as a globe and as people in the globe, and also what scientists have done, and all the healthcare workers doing their best on a daily basis. But we know citizens too have a responsibility to play when it comes to doing things that will help in combating COVID-19. So please don't forget to mask up. Whenever you are in an area that is very crowded, because you don't know if that person did took their vaccine. You know, maybe you took your vaccine, you feel like, okay, I'm safe, fully protected. But think about it. I took my vaccine, but I got COVID, right? So it was disappointing at some point, thinking that, you know, I've done everything right, you know, but I still got COVID-19. Why is that? That's just to tell us that even though you protected, well, you're not 100% protected, so you need to add the mask, the hand washing, all the other different things that you can do to really keep yourself healthy and safe out there. Don't forget to clean doorknobs, phones, tablet, laptop, anything that you're using on a daily basis. With that, you'll be able to really, you know, stay away from COVID-19 as much as you can. And if you get the vaccine, you know that you are guaranteed with some symptom relief or disease complication or the complications that comes with COVID-19. So until then, for another health talk, this is Dr. Isatu Kakay-Diallo. Thank you, and thank you very much for putting me in your prayers. God bless you. May the Almighty Allah reward you for what you are doing, and let's continue to pray for one another, and let's continue to be positive in what we are doing. Thank you.